Welcome to the Defense and Aerospace Report. I'm Vago Muradian here at the Excel Center in London, where we're covering the DSEI trade show, world's largest air, land, sea, space, cyber, and security trade show. Our coverage here is in partnership with DSEI and Clarion Events, and today is our medical day, so we're focusing on the Royal Army Medical Corps. Melanie Chesnokov is the project manager of Advance, and Major Peter Lefeuve is a physiotherapist in the Corps. Melanie, I want to start with you. Talk to us a little bit about the ADVANCE program, which is the Armed Services Trauma Rehabilitation Outcome Program. Talk to us a little bit about what you guys do.
Yes, so what we are doing is looking at the long-term health outcomes of our most serious combat trauma casualties from conflicts in Iraq and Afghanistan. So all men who were injured between 2003 and 2014, who were aeromedically evacuated from theatre direct to a UK hospital. Nobody has studied this group of individuals worldwide to date, so we are putting together a body of evidence which will allow us to plan for care for these individuals going forward over the next 20 years. So the study endpoint is 2036, and the study kicked off last year in 2016.
And talk to us from the standpoint of a uniformed person, how important this study is.
Well, we're looking at a very unique cohort of individuals, injuries that we've never seen before, and from a rehabilitation perspective, we have put together a package for which we have some fantastic outcomes, and we've shown progress functionally in a way that we've never seen before. But we want to see how that continues through life, if you like, because we want to be able to inform the rehabilitation pathway for future casualties that may come through the system in the future.
Melanie, what are the key takeaways from this study as you've looked at this sort of global gigantic database? Yes. What are the key takeaways that you've learned?
The two main areas that we're looking at is cardiovascular health and outcomes relating to that, and also osteoarthritis and issues relating to osteoarthritis and osteoporosis. So the two main measures we're looking at. We're looking at the mental health also of our cohorts in the long term as well.
Right. Major, let me ask you this question. I mean, when you talk to American doctors, one of the things they say is that, especially for amputees, there can be a large degree of normalcy while they're young, but the energy consumption level to do what you and I do naturally is stratospherically higher. And so the challenge they see is somebody might be very fit and healthy, but by the time they start to reach their 60s, being able to use artificial legs and limbs starts to become a challenge. And as you said, we're mapping through life care and will now for many, many decades, probably for longer than past generations in terms of better health outcomes overall for society at large. Talk to us about what the challenge there is from a physiotherapy, from a support, from an emotional health. Talk to us about the long-term game here.
Well, I think just if I can go back a stage first, one of the interesting things is that the developments within emergency care means that within the military we saw this unique cohort coming through, but now in civilian practice, all these lessons learned have filtered through, and so these are the casualties of the future, not just in the military but civilian. So how we care for them, what we provide for them is really critical. And we did some really interesting work a couple of years ago where we looked at the energy expenditure of the amputees that had gone through the military rehab. And we were able to show that they were significantly more efficient and they had significantly higher oxygen capacity than we'd ever seen before. And we were able to age match that research against civilian populations that had the same prosthetics that were similar age group. And so it seemed that the benefit that they'd had was something within the rehab pathway that we provided for them. And I think it's really important that we, with this work and with other work that we're doing, that we capture these lessons because it's important that we provide the appropriate volume of care so that, as you say, as they go through life, we can keep popping in the input that they require to, as much as possible, keep them on their legs, because we want them to live lives where they're socially integrated, they're employable, they're contributing positively to society, and that's really our aspiration in this whole process.
And what's next for the program as you guys, are there different sub-studies that you guys are going to be conducting?
Actually, we're going to be working with Major Feuvre on some collaboration going forward. So maybe you want to say a little bit about that.
Yeah, so I'm in particular, along with the advanced study, I'm going to be looking at the gait being their efficiency of walking, and 5 years down the line, how efficient are they, and are they maintaining their oxygen capacity, as you've alluded to, and also how qualitatively. So how do they feel they've integrated into society? So we've made an assumption that to keep them on their legs, to keep them walking, it equals good quality of life and good employability. But is that actually the case? So, and I'll be using the research, also the evidence coming through Advance in terms of some of the outcomes to be able to help chart that and answer that question.
Let me ask you a mental health question. You mentioned that at the very end of it, even though you guys are much more, we're talking physically here, but mental rehabilitation is key. Is there enough being done? I mean, suicides have been a major issue in the United States with veterans of Iraq and Afghanistan, to the point where it's also spread into some of those who have not necessarily had as much service, but particularly that community. What are you finding, and are the programs now structured and in place to help those who need help? Because military people have a remarkable tendency of saying, I'm perfectly fine, I can handle this, I'm a tough guy or tough gal. Do you have the programs, what have you found, and do you have the programs in place?
I think there has been a sea change in terms of the armed forces trying to break down stigma and to make it okay for people to ask for help. From visiting some of the Army units who have eligible personnel for the study, there's definitely a much more open attitude towards talking about mental health and towards asking for help. It's no longer seen as such a stigma and as a blemish on your service career if you do ask for help. And it's my understanding that there are good programs in terms of depression, anxiety management, alcohol reduction programs, and also for PTSD in the military. I know there's a big demand for these services, and so we may not always have a very quick turnaround for if you are accessing these services, but I think the help is there, and it's we are seeing people encouraged to come forward and seek help.
Major?
Yeah, I'd agree, and I think as well, obviously I'm biased towards the physical rehabilitation, but unless you wrap it all up and you look at this individual as a holistic individual, you're not going to deal with all the different components important within their rehabilitation. So I'd agree, and I think it's key that we signpost them at the right times and that they're aware of the support that's out there. Yeah. And that certainly seems to be helping really in what we're doing.
Yeah.
Major Feuvre, thanks very, very much. Really appreciate it. Melanie, thank you so much for joining us.